Across Nigeria, young girls are making life-altering reproductive choices, often without access to full information or safe medical care. From unprotected sex and teenage pregnancies to unsafe abortions, egg donation for cash, and limited use of contraceptions, these decisions are shaped by a mix of economic hardship, cultural taboos, and gaps in reproductive health education. While some of these choices are driven by empowerment and the desire to plan their futures, others are born out of desperation, peer pressure to financial or even family coercion. Also, misinformation plays a part, leaving lasting impact on health, education, and economic opportunities. As the debate on women's rights, healthcare access, and fertility awareness grows, the question remains: how do we create an environment where young Nigerians can make informed, safe, and autonomous decisions about their bodies and futures? In Nigeria, unsafe abortions are a significant public health concern, contributing to high mortality rate, with high maternal mortality ratio estimated 496 to 814 maternal deaths by 100,000 lives birthed. Most young girls and women who are making reproductive choices are often unaware that they are selling their wombs, leaving their lives at risk. The pain they experience in the process is significant, but what are the long-term impacts on these girls and women, especially regarding those effects that are rarely discussed?
Hello and welcome to 360 Youth Dialogue. Like I always like to say, if it's affecting the youth, we are talking about it right here on 360 Youth Dialogue. My name is Juliet Ora, and it's good to have you on this episode. This episode we'll be talking on young women, the crisis of the young women, youth, and their reproductive choices. Are young women making nice reproductive choices? You know, the pressure that comes with contraceptive pill, abortions, egg donations, what else? There are a lot of reproductive choices young women are forced to make, maybe due to depression, frustration, or even pressure from families, friends, and even financial pressure. In this episode, I have here Dr. Adam Dawood. I hope I pronounce it well. Dr. Adam Dawood. He's an epidemiologist and public health expert at Bio Private Consult Limited here in Abuja. You're welcome, Dr. Adam.
Thank you very much, and I'm happy to be here with you viewers.
I mean, it was such a short notification, and Dr. Adam made it here on 360 Youth Dialogue. I really appreciate. Thank you for coming.
The entire pleasure is mine.
Okay, before we move into the main focus of the day, the reproduction and reproductive choices of young women, the crisis, the womb for sale right now. What, from your research, like you said, the epidemiologist is like a certified medical researcher. What's your greatest research you found so far?
Well, see, in reproductive health, we try as much as possible to allow things flow normal.
Okay.
Because if you try interventions, that means you are actually interrupting the normal processes. So for any normal young woman that has reached the age of puberty, that is what we call menarche, and that menarche is when she starts seeing her menstruation. So from that time, it is expected the young lady or young girl should be taken to hospital for some good discussion with a gynecologist, and that will help her to understand she is now into a phase of womanhood. So how the menarche, that's the beginning of the menstruation, will actually change her way of life, will be discussed. Example, she should know that monthly she will be experiencing some menstrual bleeding. Now the menstrual bleeding, as it comes, there are some ways that we advise about hygiene. And some of the signs she might notice when the next one is going to come. And during the first sighting of the menstruation, in some women, they don't see it every month. So all these have to be explained so that she will actually know that if she doesn't see it, it's not that something has happened to her. Then when she's seen it, it is normal, and there are certain symptoms that comes with it. We explain to them, and by so doing, you see that the lady in question will now be ready to accept her arrival into womanhood. Now, when that is done, we realize that through research, those that are well enlightened about these menarche processes, they tend to actually have a very good flow of their gynecological processes, because when they see anything that is not as familiar, they move straight to see the doctor. I know, remember, this menarche starts between 9 to 13 years old. So if you introduce that linkage of a young girl to knowing that this is a gynecologist that will be helping her on her reproductive issue or her womanhood issues. So if she sees anything that is now going to be not as expected, she will immediately go and have some discussions. They will counsel her. If it needs her investigation, it should be investigated. If it needs treatment, it should be treated. So by so doing, research has shown that those that have primary contact during menarche with their physician, they tend to actually have a very free and normal lifestyle in terms of womanhood. And this lifestyle has to be getting ready for marriage, getting ready to be pregnant, delivery, motherhood, and then weaning.
Interesting.
So these are all encompassed, and these are actually what we actually try to educate the lady right from that menarche stage. So we give her an overview of how she will expect the womanhood to be. And those that have actually started with this type of primary physician consult, they tend to have it very smooth and nicely. On the other side, those that tend to just enter the menarche based on the little experience of other people, they guide her and say, okay, use this, that, it's normal, now you are this. And our maybe grandmothers, what they tell the young girls that start menstruation is, now any man that touches you, you are going to be pregnant.
They actually told me that.
I know, that is what most of these grandies used to tell their
young children
that when any man touches you, you are going to have you will be pregnant. Now, that now steers the woman completely away from men. And you know, that fear continues even if she's married. Because we have been getting information from our patients or clients that if the man doesn't even make much efforts, even in marriage, to try to get her closer, you realize that she doesn't have interest. And that fear, that first fear that has been incited in her is always there. Any attempt for the man to touch her is pregnancy. So then by so doing, you realize that they tend to have a very negative aspect when it comes to getting social, culturally bound to any man, and even in marriage. So research has shown that those ladies or women that have such good contact with physicians and they have explained how this womanhood is, they tend to actually live a very good life. They will get married.
So
well,
they go, those that visit their gynecologist and physician, they go through this period, these reproductive periods, easily,
without
quite easily.
much complications. Yes.
Wow. So I like what you said about in your research and science not wanting to meddle with nature.
Exactly.
But currently we're seeing a trend of egg donation, and that meddles a bit with nature because, like I heard, and from research, they actually, should I use the word facilitate the egg to rupture or something like that? So let's talk about that. What do you think about this, the egg donation, abortion, and all that? That actually
Yes.
thwarts the nature of human.
Exactly. Now, egg donation comes in when there is infertility problem.
Okay.
You have mentioned abortion. In those 5 years back, maybe 60s, 70s, and early 80s, some women that have unfortunately been pregnant and they don't want it, if they go for an abortion, what they experience is a procedure that is called termination of pregnancy. So it will be, the pregnancy will be aborted, and during the process, that is what we call curettage. They curettage the uterus to remove all the conceptus. That's the product of the conception. So in the process of removing it, the metallic ion that is being used to remove the retained products of conception tend to create some problems. And we call it uterine synechia. Now, if there is uterine synechia, there is tendency that woman might not be able to get pregnant again.
Wow.
Yes. But this is in very olden days. Now, because of modern technology and research, we don't actually use such things we don't curettage uterus again if we want to do abortions. Yes, there are a lot of good methods now that are employed. So from late 80s to now, things have been very improved. Before you see a case of uterine synechia, now maybe it will be 1 in 1 million cases. So, but in the olden days, that is one of the causes. I know these people that are now coming that really want, they are so desperate following infertility, they want to have babies. They are those that have been in those years that I've just mentioned, 60s, 70s, okay? Now, if they are so desperate to have a baby, and from all our research and investigations, if we realize that she cannot be able to do some of the options that some of the obstetricians give, is they can have egg donation. Now, this egg donation, it's supposed to be done in a very exclusive and comprehensive means, with also understanding of the person coming to donate and the person that will actually receive the ovum. But what we see is a lot of corners are being
very true
maneuvered to avoid the normal conditions. And because of socio-economic pressure, we realize that some young girls that have some financial problems, they can easily be lured into going to donate their egg. And when they donate, they are left with all the consequences that can arise. And because of that, you realize that there is what we call third party in such a business. The doctor is there doing his work, then somebody else is coming to liaise that he will be bringing the girls that will donate the egg. And this susceptible woman that will now benefit from the egg donation will be asked to pay certain amount. And they will now pay the person that is donating and also pay for the procedure that the doctor will do. However, you realize that they are not adequately compensated, especially the person that donates the egg. Yes, because you are donating your egg to another person so as to have a baby. You are left with a lot of complications that might not be even explained to you. One of the complications is hyperstimulation of the ovary, ovarian hyperstimulation syndrome.
Yes.
And it is a complication that can allow her to have multiple ovarian
Okay.
ovary production, and by the time maybe she wants to give birth, this is how it can lead to also multiple
Oh
pregnancy.
my God.
So, and
Excuse
if
me.
you are not ready for that, what happens?
Mm.
It also have a complication of it is a very important pregnancy that every now and then you have to be seen. So look at the health burden and health hazard, and it also involves some hormonal
Imbalance.
preparations. So
Okay.
you are giving some hormonal therapy, and those hormones, when they enter human body, they also have their own mediations. So you realize that a lot of complication is coming to the person donating the egg. And most of the time they don't explain all these challenges and complications to the egg donor. And
Well-
because of that, you realize that things are compromised.
Okay.
And then the amount they would take to give the girl that donates will just be very insignificant.
Do you think they should be paying them for this service? Because for me, it's like an act of service for the person who can't give birth. So should there be a fee for this?
Actually, that is why it is a very lucrative market now, because they actually pay those that donate the egg.
Oh,
They
it's like
pay them
real good money.
real money, depending on the specialty of the doctor that is actually going to harvest the egg, and how successful he has been in the
In
practice.
the business. Oh.
You realize that some egg donors, what they give some egg donors vary from one center to the other. They
So
it can vary from 500,000 to 2 million.
Interesting. In
So
Nigeria.
you see, it is a big money that
Yeah.
young girls that are having some financial problems can easily go into.
But does the Health Act of Nigeria condemn this?
Of course, you know, in Nigeria, apart from our normal health regulations, we have ethical undertones in which we have to now consider our religion background. And mostly we are Muslims or Christians, and you realize in both religions it is not acceptable, because it's like you are modeling with human nature.
Yes.
And the regulatory bodies are really there. And we have the Nigerian Medical and Dental Council, we have the Standard Organization of Nigeria, and we also have the Public Health Regulation Board, and so on. But believe you me, these people, they go undercover and do all these things. It is when, unfortunately, a complication happens that when it is picked up, then they are actually brought to their knees. And it will now be unfortunate then.
But if you're saying that they go underground to do all this, there are centers that go publicly to social media and say, oh, we're in need of egg donor, donate your egg for so amount of money. And you see girls chatting, say, I'm interested. So is this something that's under the nose of this, health organizations and health watchdogs?
You see, in medical practice, it is completely prohibited for any doctor to come and be advertising his expertise or his hospital or his practice or his successes. Yes, it is prohibited. And if you are caught, you will be arrested. There are a lot of conditions that you can go to. In fact, at a very alarming stage, your license can be withdrawn. Your license to practice can be withdrawn. If you are found advertising what you do as a doctor, or you're having success, you're advertising, it is not allowed. The Nigerian Medical and Dental Council have a legal unit and are very stiff in actually getting people so that they will show them as example to those that are doing it. And I'm quite surprised that some people are coming to say it. I know because of social media, it can be going around through social media.
Yes.
So through WhatsApp and co, and it's very unfortunate some of the regulators might have access to that. But believe you me, if the regulators happen to come across such an advert, it is a quick win for them to go and show to the world that we have regulations in Nigeria.
Also, concerning this egg donation, I saw a trend. I saw a post because I followed it. I was like, interesting business and interesting topic. And we saw cross-border fertility, girls going to Ghana, and it's just open. They say they are paying for your flight, they are paying for your accommodation and all that. And it's more lucrative when you look at this. Is it that the health people or health organization, they are not seeing this, or they're just playing blind, or these are fake doctors?
As I told you, there are intermediaries. No licensed doctor, no licensed medical doctor will come out and be advertising himself to be sourcing for ladies that will come and donate their eggs for his reproductive practices. And to be very frank, if he does, once he's seen, he will be apprehended, and the normal.
But can they recruit people to do that?
The normal rat of the law will actually catch up with him or her. But the third person that they use, those are the people that are doing this, and they send them through social media, either WhatsApp or Facebook. And it is also another means of slavery.
Like trafficking.
And trafficking. It's another means of slavery. And what is slavery? To take advantage of people that are not financially,
against their will.
Yes, stable, against their will, to show them that you will give them some financial support, they will do this, do that. So it is also a form of slavery and human trafficking. So, and there are laws against it in Nigeria and also in other countries.
Yes.
So they are doing it as undercover, to be very frank with you. When they go through social media, it is very difficult for regulators to go there and see what is happening. It is only when something happens negatively that they are now apprehended and they start talking how they can get out of the trouble. But to be very frank, it is not an expected practice that you announce and you start practicing. If it is one of the reproductive alternative that egg donation is what will help the index patient of the obstetrician. The obstetrician, will tell the client exactly what she will do, which is, you might benefit from egg donation, but please go and get someone that can do it for you and bring the person. And when we bring the person, we educate the person and so on. And most of the time, they get person from their own blood, either her sister or her cousin, or the husband's sister or the husband's cousin. Depending on how good rapport the woman is with the entire family that she belongs. And in so doing, you see that it will be very seamless, and the gynecologist and obstetrician will explain how this process is going to be to the egg donor and then to the recipient. And you realize that all the complications and normal ways that things will happen will be explained, and by so doing, each and every person will be ready for the procedure. And in terms of reward, is better even if she's her relation, they agree on certain terms that because of this help you are doing to me, I'm going to support you with this. So you see, in that aspect, the lady is not selling her egg,
Exactly.
but she's assisting so that her niece or her sister
Yeah.
will be able to conceive too
Yes.
through such a process. But don't forget, we have other means of doing assisted reproduction.
Mm-hmm.
There is egg freezing.
Yes.
We can do IVU, in vitro fertilizations. We can, in fact, in advanced countries now, mucus from the mouth
Wow.
can be taken and some procedures will be done and the egg can be generated from her
Wow. That's innovation.
mucosal saliva, and the husband can now donate his produce his sperm at the right time to now fertilize the ovum and they can have their baby. Yes.
That's interesting.
And we have what we call surrogate.
Yes, surrogacy.
Surrogacy procedure. So, but you see, all this, where it becomes criminal is when the concept is not explained to the donor, and if it involves payment, the exact amount that the person is supposed to benefit should be known and should be given. And the complications and outcomes should always be related to the egg donor too. So that, you know, psychology has it, if you know about something, you go into it wholeheartedly. But if you don't know and you are just interested in money, you are human. Deep inside, you know that something is going to be taken out of you. So you will now feel that something might happen to you. So that fear itself, you are leaving the person in jeopardy, and the person can easily become depressed. So you want also to have more mental people in the streets? No. So even for the government, for the citizenship, it is a burden on us. If we continue to do this thing without checking, and that is why regulation is paramount, and it is in place.
Okay, so let's talk about people now that are aware, people that are willing, people that know, they've read about it. They're not financially broke. They have the money, because I saw on BBC an egg donor. She's from Nigeria, and they asked her, why did you go into this? She said she was just curious. She just wanted to know what's this about, and she wanted to just donate her egg to help a family out there. So is this something that can be regulated, seeing that these people are of age, this is their body? You cannot come and tell them what to do or what not to do with their body. This is their body. And if they say they want to donate their eggs, do you think it can be do you think it's something that can be regulated in Nigeria?
Now, actually, you know, the idea of someone coming to say she wants to donate her egg voluntarily, this is what you are referring to, voluntary donation of ovum. It's okay, but where it will be very pertinent is good health awareness should be given to such people. They should know the consequences. They should know the procedure very well, the complications, and even the recipient of the egg should also be aware that some of them that can come voluntarily, one day they can go into litigation. Of course. They can. In America, some people that have done that, when they go into financial problems, they come back and say the child is theirs because it is their ovum. And they can move into litigation and they charge a lot of money.
Yes.
If the money is not given, they take custody of the child. Yes. So a lot of complications are involved. And these things, that is why awareness about this issue is very, very important. Unless we have public health awareness on this issue and tie it very well with some regulatory buttons,
exactly,
then we won't be able to have it the way people think. You can say today you want to donate voluntarily, but tomorrow
Tomorrow you
when you enter one or two problem, you know that it is successful.
Yeah.
That child is because of your ovum, and now
Mm.
you are not even, and you'll be compensated. You finish the money, and now you are broke. You can now start to come
Look
up with
for
some.
who is with your
So,
egg.
and that is why this public health awareness is very important. And at a certain time, that is what we call, you have to sign
Exactly.
what we call consent.
Okay.
So it is this particular aspect that will actually exonerate any further litigation. So you, as a woman, if anyone says she's coming to just give you her ovum, her egg, so that you do this, do that, be very careful. Even if you are paying at that time,
But sometimes
make sure consents are signed and you have a copy and keep it with you for life. In fact, take it to bank. Let the bank keep it for you the way you are keeping money. So that when the
person comes to claim the child, you have your
yes,
proof.
well, exactly.
But currently, we're seeing girls just donate egg. They don't even know the family. They don't know the end person or whoever it's.
Yes,
just take the
told
egg.
you, it's due to financial constraint. These
So
are
they
people-
in the future, they can't go back to claim their egg because there's no database.
Yes, and because that is why the intermediaries are having it their day. They're having their day in the business.
Yes.
You deploy you, you will never see the woman that you are donating the egg to. And you will not even see the doctor if care is not taken. When we on the day he's just going to harvest your egg, that's when you will see the doctor. Most of the things you go to lab and do this.
Yeah.
They check you and say they admit you in the hospital. In fact, it is actually very criminal, to be very frank.
So
Things should be done normally.
I want us to talk about who is the winner, who wins and who loses. Is it the health practitioner? Is it the donor, or is it the person that's being donated to, the beneficiary? Who wins and who loses in this game?
Yeah, to be very frank with you, it is win-win for the three. Yes,
Okay, nobody.
for the three,
Nobody
because
feels.
yes, because the practitioner is going to have his own full charge for what he takes to do the procedure for harvesting the egg, passing it to the susceptible recipient, monitor her to delivery, and then take care of the egg donor person until she is healthy and normal, then you discharge her. So both ways, the practitioner will have his wage. He will not actually compromise his efforts.
Do you think because of the whole win-win-win, everyone is winning? That's why the fertility baby factory is booming in Nigeria.
Yeah, that is. It's not only in Nigeria; it's everywhere. You know, even men do donate their sperms. If you don't know, some men, they go and donate their sperm and they collect money, so that they use it on women. Those men, the woman will not know who is the man. Yes, and they give them a lot of money.
So it's like everybody's involved.
That is
Men,
it.
women.
So
are
we see the
involved.
financial situation we find ourselves in globally tend to allow some options that are not actually very conducive to our culture and our moral and also religion support. So when it comes into medical practice again, in medical practice we try to regulate and keep both culture, ethics, and the practice itself into a very good flow, so that there will not be infringements. Now, because of this, that is why we have what we call public health enlightenment, public health awareness, and there will be signed consent before all these things are done. At the same time, it is very important you explain to each and every participant his role very well and the antecedents that might follow. If you don't do this, at any point in time, any of the person, either the donor or the recipient, can even take a litigation process with you. Example, you did not tell the woman after receiving this ovum that with this in your body, you start developing some funny symptoms. you become very uncomfortable, this, that. You know, signs and symptoms of pregnancy, they are special. They did not tell this woman you now do, and she started having all these symptoms. You did not explain them. She finds that life is just so difficult. Some of them can even tell you, please remove this if this is what is. But you have to, that is why you have to explain.
Exactly.
Because no obstetrician would like to start this process and then he will be asked to reverse it. You see? So.
Well, let's come back to the win-win-win. But for me, I think it's a win-win-lose, especially for the donor. The young girls now, like you said, public health is very important. Awareness, know what you're going into. And in the beginning, you mentioned the implication, which is multiple, you called it something.
Stimulation.
Yeah, multiple
ovarian
stimulations. But before we go to the implication, can you take us through how this works, which is egg donation, abortion, and, you know, everything that has to do with reproduction? Let's start with egg donation. How does it work?
Yeah, actually, the practice tends to maximize on the ovulation period of the woman. So ovulation is occurs actually at mid-cycle. And at that mid-cycle, once the egg is dropped, that's when it is harvested.
Okay.
And it only takes 2 days to survive. After 2 days, it becomes denatured. And another cycle of menstruation will start.
Okay.
So at mid-cycle, during the ovulation, the obstetrician will actually maximize that time and now use a procedure to actually harvest the ovum. And by that time, the recipient is also going to be informed of successful harvest of the ovum. And then the ovum will now be adopted to be able to be passed into the woman. And once it is passed into her, the normal processes of conception begins. As I told you, it is all hormonal. It is a hormonal activity. So hormones are now actually into play. Estrogen and progesterone. Those are the 2 hormones that are actually used in.
But do they stimulate the donor to produce more eggs?
Yeah, sometimes it can be done. But in some young girls that usually they produce, they just normal, like young girls that have never undergone any alteration of their menstrual cycle, you realize that they ovulate as expected. And once it is like that, they just harvest the egg. Now, why they introduce some hormones to produce more ovum is because the process has to be successful. It's not easy to just get one egg. If you have multiple eggs, even if along the process 1 or 2 went bad, at least if one among the 3 or 4 that you have becomes successful, at least you have a baby.
That is why. How many can they harvest in one procedure?
No, it depends on the availability of the ovum. If I have up to 5, why not? I can introduce them into, I can harvest them and then start my processes, so that at the end of the day, I will be sure that at least 2 or 3 out of those 5 will actually become viable. And my client or my patient will be pregnant and monitor my patient to delivery stage.
We'll take a short break, and after that, we'll delve more into the implications and who wins and who loses. Stay with us.
For now, the ladies, you may be thinking that it doesn't concern you as far as there's money. But in life, it must surely come back. It must surely play back to you. Because when you reach a certain stage, a certain mature stage, that you must have a baby, must have children, you cannot do without kids when you are advancing in age. At that point in time, you will be challenged. You will see your colleagues that are having kids, and then it will be as a disgrace to you then. So it's a very serious matter. If a lady is doing that, in fact, they should call themselves to a turn back position.
No matter the condition, no matter what you are facing in life, selling your body is not the right thing you should do. It's very, very wrong. To me, that's the only thing I can say.
This economy now is mind. You understand? It's mind. Because a lot of people now are passing through a lot of things, depression and all that. So some people, it will push them to go and sell their body. But for me, I'm a hustler. I sell tiger, and I don't put my mind in selling my private part just for money.
Ladies live, most of the ladies now live above their income, live above their needs. Okay, now your condition is still in one room self-contained. You are aiming 3-bedroom, and you now begin to rush, you now begin to run. Finally, you get that 3-bedroom. Then how will you continue to manage that 3-bedroom? From there, that is how you see ladies begin to move around to do all manner of things. You see them prostitution going about and all that. Those are the things.
If maybe tomorrow anything happens, you started looking for the fruit of womb, which is the risk, which is the disadvantage that is there. But if it is something, for me, I cannot do it. I cannot do it. It's not advisable for me to advise any lady for them to sell out their ovaries because of money. Because majority of ladies that does it, they does it because of money, not because of anything. Not because they want to help, they just want that money. That is why they are doing it. So for me, I cannot do it.
Thank you for staying tuned here on 360 Youth Dialogue. We are broadcasting only on Third Eye Africa TV. And we've been talking about reproductive choices by young girls, young women. And I've just understood that it's not just young women that make these reproductive choices. Even the men too donate their sperms and, make reproductive choices. I've been having this conversation. It's been an enlightening conversation so far with Dr. Adam. He's an epidemiologist and health expert. And let's go further to the implication. You were saying that the girl can produce as much egg, and as much egg she produces is how it's been, removed. Now, does this have implication, long-term implication, despite the pain or the pain in the process at that particular moment? Is there like a long-term process? Because you said it's a win-win-win. But for me, I think it's a win-win, probably lose for the donor. So what are the long-term implications nobody tells those people about?
Yeah, one of the long-term implications is because she is going to undergo what we call ovulation priming by giving some hormonal drugs to produce more ovum. You realize that by the time the effect wears off, some of them might not be able to produce, especially at menopause. They might have early menopausal symptoms or go into early menopause, and then some of them can also have some infertility sequelae or complications. So you realize that if a lady, a young girl must undergo this procedure, it will be advisable within 2 to 3 years, let her try to get married so that she have her own natural children, yes. Not to allow her just continue donating, and after some time when she now wants to have a baby, it will be late for her to deliver or to be pregnant. So once that type of awareness is given, I think the egg donor can actually make up her mind about when will be desirable for her to be pregnant and deliver, which is actually a very wise decision. Now, where it will be loose is if, based on certain socioeconomic factors, she's unable to couple with the advice and awareness that she has, and unfortunately, she also become infertile.
So it's
that
like sell your today
yes
against
and
sell your tomorrow today.
that is it. And it can also be another lose to the recipient if there is litigation after about 10 or 15 years or 20 years that child is my child because you use my ovum. So, no matter what, there will be, we say palaba.
Exactly.
So there will be trouble and it will not be easy for the recipient too and her family. And then the doctor too, if alongside there happen to be some report that is also encouraging human trafficking, is encouraging slavery, you also face litigation. And almost all what you have been getting from the process or procedure, you might use them and even more to actually free yourself from the litigatory cycle. So it's not really a conducive practice when you look at the consequences that might follow to both parties. Yes, so that is why God in His infinite mercy has now given us informed ways of how we can go out into other alternative ways that can be safe again and like natural, and then you have your babies. Exactly.
So you said that sometimes this donor may not be able to conceive on the long run. So, and it's not everybody that donate their egg today that would want to get married in the next 2-3 years. And we see people donate multiple times. So it's like they have possible or likely means or measures of being infertile later in the future.
It is one of the complications. Yes, clear. And
they are not really aware of this, are they?
That is why public awareness about it is very paramount. The doctor that is going to harvest that ovum or egg must actually sit the person down and explain deeply all the necessary conditions and consequences that might happen, so that the person will not make up his mind or her mind in terms of his, that is the male. In male, anyway, we don't have any complication.
Yes.
Provided
really, there's no complication.
No, we don't have many complications. We just tell you the only complication is by the time we send your sperm to lab, if the viability and the volume and the spermatic sperm flow or movement, motility is not too good, then we'll tell you are not a good donor. We can't take your sperm.
Okay, that's
but
all for the
that's
men.
all for the men. So automatically you'll be out of the process. But if it is in terms of the man, once we collect the sperm and laboratory tests find you fit, automatically you are fit and you just use your sperm for it. But for the women, they have to be primed, because by the time we take one and the procedure fails, that's all. She has to now wait another month for us to pick again. Because that's why we primed her to have multiple egg productions. And so it involves hormonal manipulations. And that is actually, yes, to allow her to produce more ovum.
So these hormonal manipulations, do they affect her psychological, or is just,
Of course, even the mere fact that you are taking this medicine to help you have more ovum, it has some psychological implication now.
Does it have like a reproductive disease related like reactions in the reproductive organ other than infertility later on in future?
Well, other factors can come because there is volume retention, effects of hormones.
What does that mean?
She can be fat.
Oh.
Yes.
I'm sorry.
Yes.
So
she can become fat, and then she can have some other, especially for those that are doing it always, or they tend to do it when they see they don't have the money they have gotten before is finished, they go for another cycle to be able to harvest their egg. So multiple hormone therapy can lead to some other complications, heart disease, atherosclerosis. If you are prone to diabetes, it can easily prone you into diabetes. Then if you are the type that have some other respiratory factors. Because of the weight that you add, you realize that you'll be getting some respiratory complications. Yeah, so these are part of the complications that can happen, but they don't come easily. You don't see them easily. And unless good history taking is done by the doctor that they seeing you. Because it's not easy for a woman when you go to hospital, you have one of these symptoms conditions I just mentioned. If you have the symptoms, you just go. It's very difficult for a doctor to ask you, did you donate egg? Did you take some hormonal therapy, you know? So, but it takes a very clever doctor that will now ask such things and know and start effective treatment that will actually reduce some of your symptoms.
Very interesting. So it's like donate today and face the fear of tomorrow.
Exactly, yeah. I like that statement. Face the fears of tomorrow. Yes, because you don't know, it might be medical problems or
psychological
or infertility.
Like the problem you're trying to solve for another, you adopt it. Very funny. And then why I laughed when you said the weight gaining is that looking at how concurrent people are going into the egg donation. So in like 5 years, we'll be seeing a lot of fat people.
You know, what is happening is in developing world,
yes,
which Nigeria is also part of it, you realize that many people tend to be adding weight. Because as you are becoming stable financially and otherwise, you want to live a better life. And in living a better life, you even do certain things that will prone you to be obese.
Yes.
So that is why we have what we said, lifestyle modifications. So you have to be doing some routine exercises so as not to blow out and so on. Yeah.
Very
so
important.
They are all part of life. When you go to America, you find people that are 5 times your size. They will find it difficult to move. You don't know what they have done before.
Yes, very true.
These are part of challenges we live with in life. Yeah.
Very true. But despite this long and short-term, implication, we still see girls who public health experts have told them, okay, this is what you're likely to face, this is what you're likely not to face. And then even the recipient, the donor, everybody are well, taught and well aware. But we still see girls go into this. What do you think pushed them into this, aside, the socioeconomic parts that everybody's saying? Anything right now, people will target to, there is no money, and that's why I'm doing this. But other than that, what really drives young girls, young men to go into this?
Well, in the society, you realize that you cannot define some factors that can push every person to doing things that are hazardous. But within some of the discussions that have been going on, there are some women that are lepas, bracket. They want to be fat. And some of them have tried all other means, they are not fat. So some will say, but if you are pregnant for about 3 to 4 months, you add weight. If you add weight, you can now do it with the pregnancy since you are not ready to give birth. And if they notice one of her friends that has done this process, realize that after she added weight, if she now told her this is what she has done, she might decide to go and
try it out.
Try it too, to maybe she will add weight. So these are remote reasons that I'm just trying to put across, but humans are undefined. You realize that what you like might maybe what the other person likes. So they have more reason, but to be very frank, other factors that we have seen is the quest to actually japa.
Interesting.
Yes. If she knows by the time she is taken to abroad to donate her egg, she will be assured of staying there for more livelihood and other means of survival. It will actually also motivate her to go and donate the egg. Yes. So invariably, different factors play concerts in what determine the reason why some of the young ladies, now we see even middle-aged ladies, they donate their eggs. So it's not only young girls. Yes.
So there's for the middle-aged people, they've made up their mind that even if I don't give birth in the future,
No problem.
interesting. But let's come to the justification of this. Is this justifiable?
Well, you see, justification, it depends on the need of the person. Like I said, if she is donating to help her resolve some of her financial constraints, it is justifiable to her. If she's going to be given visa, done passport, take care of her accommodation and where she will stay when she is taken abroad for the egg donation, and at the end of the procedure she will be there to have a work that she will do and live a very good life in abroad as they claim. So it will be a process of safe japa. It is justified to her. You understand?
But to the medical body, is it justifiable?
Now, for the medical aspect, if she is at the active age, say between the ages of 18 to 25,
Okay.
and she does this, I don't think there is any repercussion. It is something that the body will now annul, and she will actually take care of her normal cycle before 35, 40, and then 45 when we start thinking of menopause. Yes. So, but to be very frank, if it is done in such a way that much awareness is given, the complication, the implication, and then the type of lifestyle the person is expected to live after donating the egg, at the same time, the ways the person will now try to plan for her own, because she is assisting someone that has not been able to be
Give
pregnant. So it is now a signal to her that since I'm not donating to someone that is infertile, in order for me not to be infertile, to be looking for donor, it's better I also start planning to get married now that I'm even competent to be able to donate. So that immediately I will have my baby too. Yeah.
Now, let's looking at social media influencer impact on young women and men. What would you say they are learning from, or where would you say they should learn from? Like you said earlier in the beginning of this chat, that women who see their physician and gynecologist have better reproductive processes. So who should we go to? Who should we run to? Who should girls learn from? From social media or from who?
Very good. It is actually better that each and every person from each and every home should have a primary physician. There should be one medical doctor that is actually going to be assigned to your family, or you try to assign your family to one primary health doctor. So this doctor can be a general practitioner, so that if there is any health need or health awareness, it will start from him or her. And once this is done, if there is a need for further consultations, he knows the right person to refer the person that needs the consultation to.
Okay.
And by so doing, you find that life will be very easy. You see, we find it very funny in this country that people will just wake up, go to lab and say, I want to do tests. You do tests, they run the test and they give it to you. You are now looking for somebody that will now interpret the test. Sometimes not even a doctor. Or in the lab, you know, they are laboratory scientists. After collecting the test, they even tell you what and what you take. Or they tell you, you have this, you have that. You have to do this and this again. Then you do. They say, hey, yeah, try this drug. is very dangerous.
Thank
be
you so
doing
much.
that.
Thank you so much for that. I mean, a lot I have learned, a lot I have been enlightened from your words so far, Dr. Adam Daud. It's good to have you here on 360 Youth Dialogue.
It's my pleasure always.
Thank you.
you very much.
So to all our viewers, to young women, young men, I just learned that men to have donated their sperm. Although this looks lucrative for both health experts, for the donors, and for the recipients who are the beneficiaries, there is an end repercussion. There is a long-stand or long-term implication to these. If you are donating your egg, if you are making reproductive choices, remember that there is repercussions to these. Like Dr. Adam said, make sure you have a physician, a gynecologist who you consult for any reproductive choices. Thank you so much for joining us here on 360 Youth Dialogue. Stay with us always here on Third Eye Africa TV. Bye for now.